This is now our 11th round of strikes that we have had to call. We have seen a reduction in our pay by over 25% since 2008. All we're asking is for junior doctors, the ones that start at 15 pounds an hour, for that pay to be increased to 20, 21 pounds an hour. That's not an unreasonable request at all. It is reflective of their value as well-trained doctors. And it is heartbreaking. So many of us on every shift that we are on, we could turn to our left, turn to our right, and our colleagues, everybody knows a couple of people who have left the NHS, who are on their way out of the NHS, who are taking jobs, much more lucrative jobs in Australia, in New Zealand, in Canada. I could go back to the United States and earn 4 times as much working in A&E back in the United States, but I love the NHS and I'm committed to my patients here and I don't want to leave. And I know a lot of my colleagues don't want to leave. They don't want to go. They want to stay here and they want to fight for their patients and work here in the NHS. But I think that knowing that the NHS is a publicly funded system, all of us understand that our pay is going to be reduced relative to our colleagues working internationally in privatized healthcare markets. But we refuse to be abused in the way that we are. Pay and working conditions right now are just absolutely awful. We have 20,000 doctors that are leaving the NHS every single year. We have 40,000 nurses that are leaving the NHS every year. This is our staff hemorrhage crisis that needs to be addressed. It needs to be an election issue, because if we do not have safe staffing, then patients suffer. And that's why we're here doing what we're doing today. We just want to get back to work. We didn't want to be on strike today, but look, I have to be brutally honest here. This government is a threat to public health. 10 years ago, 14 years ago, when they took over, the NHS was ranked the #1 healthcare system in the world. And they now have run it into the ground. We're performing among the worst in Europe. We have the longest waiting list in NHS history, the longest cancer waiting times in NHS history, the longest A&E waiting times in NHS history. 24 hours in A&E is no longer just a television show. It is a reality for far too many people in this country. And you know, I firmly believe, in my professional opinion, that this government is a threat to public health and they should be no longer looking after the NHS. If you look at France, if you look at Germany, countries that have properly funded their healthcare systems over the last decade, France has put in 40 billion pounds more per year than we have. Germany over 70 billion more per year. The NHS is in a remarkably efficient system, and it was the most efficient system in the world 10 years ago. But it's been catastrophically defunded by government that wanted to push people into private healthcare, and they've done that by raising the waiting list to the crisis level that we are at right now, by taking away 2,000 GPs, by removing 1,000 points of primary care in this country, by taking away people's access to healthcare and then trying to sell it back to them. That is the conservative legacy, and for that reason, I believe that they need to be far from government. I'm hopeful with the next government that they will take this seriously, this threat to patient safety that we've been dealing with for so long, and solve our funding crisis, solve our beds crisis, solve our staffing crisis, and solve our social care crisis. These are major problems that desperately need to be fixed, and we need real leadership in order to fix them. Otherwise, patients are going to continue to suffer on a daily basis, and that is not something that we are prepared to watch, prepared to witness, and prepared to sit quietly while that happens.